Every single week, 3 million Americans experience sharp, burning pain on the outside of their elbow that makes even the simplest tasks unbearable. Picking up a coffee cup, turning a doorknob, shaking someone's hand, not occasionally, not when they overdo it, every single day. And here's what most of them have been told: rest it, ice it, take anti-inflammatories, and wait. I'm going to tell you why that advice is not just incomplete, it's actively preventing your recovery. In 15 years of clinical practice, I have watched hundreds of people suffer for months, sometimes years, following that exact protocol while their tendons deteriorated further with every passing week. The pain that's keeping you awake at night, the weakness that's making you drop things, the burning sensation that shoots down your forearm when you grip anything, those symptoms are not asking you to rest. They are screaming at you to load the tendon correctly. Subscribe to Dr. Waterling right now and hit that like button. We're working toward building this channel on one principle: the system makes money when you stay sick, not when you get better. What I'm about to show you costs nothing, requires no equipment, and works in 85% of cases when applied correctly. But nobody in a standard office visit is going to walk you through this because there's no billing code for teaching biomechanics. Look at your dominant hand right now. Make a fist, then open it. If that simple motion creates a sharp, localized pain on the outer edge of your elbow, approximately 2 centimeters below the bony prominence you can feel there, you're experiencing lateral epicondylitis. That's the medical term for tennis elbow, though the overwhelming majority of people who develop it have never held a tennis racket. This condition affects carpenters, office workers, parents lifting children, gardeners, painters, anyone who performs repetitive gripping or wrist extension movements. The pain typically starts as a minor annoyance, a twinge you ignore, and then systematically progresses until it dominates your awareness. By the time most people seek treatment, they've already been suffering for 6 to 8 weeks, and the tendon damage is substantial. Here's what tennis elbow actually is at the tissue level. The muscles that extend your wrist and fingers, the ones that pull your hand backward when you wave, all converge into a single tendon structure that attaches to that outer elbow bone, the lateral epicondyle. This tendon, roughly the diameter of a pencil at its attachment point, handles enormous repetitive stress every single day. When you grip something, your wrist extensors fire to stabilize the wrist while your finger flexors create the gripping force. That stabilization creates constant tension on the tendon attachment. Over time, with thousands of repetitions, microtears develop in the tendon fibers. And here's the critical part that conventional medicine gets wrong. This is not inflammation. The medical community called it tendonitis for decades, but research over the past 20 years has definitively shown that chronic tennis elbow is tendinosis, not tendonitis. The difference is fundamental. Inflammation is an acute response involving immune cells, swelling, heat, redness. Tendinosis is chronic degeneration where the tendon fibers are literally disorganized, weakened, and failing to heal properly. The tissue becomes stiff, weak, and pain-generating not because of inflammation, but because of failed healing. Let me explain the physics of what's happening inside that tendon. Healthy tendon tissue has collagen fibers aligned in parallel like tightly braided rope. When you load the tendon appropriately, those fibers slide against each other, absorbing and distributing force efficiently. In tendinosis, repeated microtears that weren't allowed to heal properly create scar tissue and disorganized collagen that looks like tangled yarn under a microscope. This chaotic tissue structure cannot handle normal loads. When you grip something, the force concentrates in the weakest areas rather than distributing evenly, creating more microtrauma and perpetuating the cycle. The pain you feel is generated by nerve endings in the damaged tissue responding to abnormal mechanical stress. Your body is sending you a precise signal. This tissue is structurally compromised and cannot handle load in its current state. Now here's where conventional treatment goes catastrophically wrong. When you present to a doctor with elbow pain, the standard protocol is rest, ice, compression, elevation, the RICE protocol, plus non-steroidal anti-inflammatory drugs like ibuprofen. You're told to avoid the activities that cause pain, wear a brace, apply ice 3 times a day, and take medication to reduce inflammation. The problem is that you don't have inflammation. You have degenerative tissue that needs to be remodeled through controlled mechanical loading. Rest does not stimulate tendon healing. It allows the disorganized scar tissue to remain disorganized. Ice reduces blood flow to tissue that desperately needs enhanced circulation to bring in nutrients and remove metabolic waste. Anti-inflammatory medications block the exact biochemical signals that initiate tissue repair. You are being told to do 3 things that actively prevent the healing response your tendon requires. Tens of thousands of people follow this advice religiously. They stop gripping things. They wear elbow straps. They ice diligently. They take ibuprofen for weeks. And the pain persists. Eventually, frustrated and still suffering, they return to the doctor. The next intervention is usually a corticosteroid injection directly into the tendon attachment. The shot provides temporary pain relief, sometimes dramatic relief, by suppressing all tissue activity in the area. Patients feel better for 2 to 6 weeks and believe they're healing. But research published in the British Journal of Sports Medicine tracked long-term outcomes and found that corticosteroid injections for tennis elbow show worse outcomes at 1 year compared to no treatment at all. The temporary pain relief masks continued tissue degeneration. The steroid weakens the already compromised tendon structure, increasing the risk of complete tendon rupture. When the pain returns, often worse than before, the patient is told they need another injection or, in severe cases, surgery to remove the damaged tissue and reattach healthy portions. I'm not saying any of this to frighten you. I'm saying it because once you understand the cost of every day you continue inappropriate treatment, the motivation to change becomes very concrete. The system you rely on for your health is not built to understand tissue biomechanics. It is built to suppress symptoms with medication and procedures. There is no revenue in teaching you an exercise that you can perform at home, for free, that fundamentally addresses the structural problem. Your next appointment will not include biomechanical education because there is no billing code for it and no pharmaceutical company profits from it. So what actually heals a degenerative tendon? Eccentric exercise. This is not a theory. This is not alternative medicine. This is established sports medicine and orthopedic rehabilitation science, with decades of research demonstrating effectiveness rates between 70 and 90% when protocols are followed correctly. An eccentric muscle contraction is one where the muscle lengthens while producing force, like slowly lowering a weight rather than lifting it. For your wrist extensors, eccentric loading means slowly lowering your hand from the extended position while resisting gravity or resistance. This specific type of loading creates precise mechanical signals that stimulate tendon remodeling. The controlled lengthening under load causes the disorganized collagen fibers to realign along the direction of force. It increases blood flow to the damaged area, bringing in growth factors and nutrients. It stimulates fibroblast cells, the cells that produce new collagen, to synthesize properly organized tendon tissue. Over 6 to 12 weeks of consistent eccentric loading, the tendon literally rebuilds itself stronger and more organized than before the injury. Let me give you a real case. Michael, 52 years old, came to my clinic after 9 months of tennis elbow pain. He's a carpenter, and the condition was destroying his ability to work. He'd tried rest for 6 weeks with no improvement. He'd received 2 corticosteroid injections that provided temporary relief, but the pain returned worse each time. He was wearing an elbow brace constantly and taking ibuprofen daily. When I examined him, he had severe pain with resisted wrist extension, meaning when I asked him to lift his hand upward against my resistance, the pain was immediate and sharp. Grip strength in his affected arm was 40% lower than his unaffected side. He couldn't hold a hammer for more than 10 minutes without burning pain. I explained the eccentric protocol, and he looked skeptical. He said, "You're telling me to exercise the thing that hurts?" I said yes, in a very specific way. We started the protocol that day in the office. Within 3 weeks, his pain during daily activities had decreased by half. By 6 weeks, he was back to full work duty. At 12 weeks, he was pain-free and his grip strength had returned to normal. That was 4 years ago. He still does the exercises twice a week as maintenance and has had 0 recurrence. Here is your complete protocol. You need 1 piece of equipment, a light dumbbell between 1 and 3 pounds. If you don't have a dumbbell, a hammer works perfectly because the weight distribution creates appropriate resistance. You will perform this exercise once per day, every single day, for a minimum of 12 weeks. Consistency is absolutely non-negotiable. Missing days breaks the tissue remodeling process. Sit in a chair with armrests or at a table. Place your affected forearm on the armrest or table surface so that your hand and wrist extend beyond the edge. Your palm should face down toward the floor. Your elbow should be straight, not bent. Hold the dumbbell or hammer in your hand. Now with your other hand, lift the affected hand upward into full wrist extension, bending your wrist so your knuckles move toward your forearm. You're using the unaffected hand to position the wrist, not using the affected muscles to lift. This is critical. Once your wrist is in the fully extended position, remove the helping hand. Now very slowly, over a count of 5 full seconds, lower the weight by allowing your wrist to drop toward the floor. You should feel a distinct pulling or stretching sensation along the outside of your forearm and elbow. This should be uncomfortable, but not sharply painful. On a scale of 1 to 10, you're looking for a 3 to 5 out of 10 discomfort level. If you hit 7 or above, the weight is too heavy. When your wrist reaches the fully flexed position, hand drooping downward, use your opposite hand to lift it back to the starting extended position. Then repeat the slow 5-second lowering. You only load the tendon during the lowering phase, the eccentric portion. The lifting phase is passive, done with the opposite hand. Perform 3 sets of 15 repetitions. That means 15 slow lowers, rest for 90 seconds, 15 more slow lowers, rest 90 seconds, final set of 15. The entire session takes approximately 12 minutes. You will feel a deep ache in the muscle and tendon afterward. That is the correct response. What you should not feel is sharp, stabbing pain during the exercise or pain that persists for more than 2 hours after completing the session. If you experience either of those, reduce the weight and ensure your technique is precise. Here's the critical part that determines success or failure. You must continue daily activities that don't create sharp pain while performing the eccentric protocol. This is the opposite of traditional rest advice. The tendon needs to maintain baseline loading while the eccentric exercise provides the specific stimulus for remodeling. If something creates pain above 5 out of 10 during daily activities, modify how you do it, but don't stop using your arm entirely. Complete immobilization prevents healing just as surely as excessive loading. The timeline for improvement follows a predictable pattern if you're doing the protocol correctly. During the first week, you may notice that the pain actually intensifies slightly. This is normal and does not indicate damage. You're loading compromised tissue and it's responding with increased sensitivity. Do not stop. By the end of week 2, most people notice that the constant background ache begins to decrease. Tasks that were painful start feeling more manageable. By week 4, you should see measurable improvement in grip strength and pain-free function. The sharp pain with gripping should be noticeably less frequent and less intense. By week 8, the majority of daily activities should be pain-free or nearly pain-free. By week 12, if you've maintained consistent daily practice, 85% of people achieve complete resolution of symptoms. If after 6 weeks of correct, consistent eccentric exercise you have not experienced any improvement, that's a signal that something else is contributing to the problem. Possible complications include cervical spine nerve compression, causing referred pain that mimics tennis elbow, radial tunnel syndrome where a nerve is compressed in the forearm, or complete tendon rupture rather than tendinosis. Those conditions require clinical examination. But if you haven't tried a proper eccentric protocol for at least 6 weeks, you haven't ruled out the most common correctable cause. Now, the most important thing I want you to hear, pain during the eccentric exercise does not mean you're causing damage. This is counterintuitive because we're conditioned to believe that pain means stop. In this specific context, controlled discomfort during the exercise is the signal that you're loading the tissue at the right intensity. The research that established eccentric training effectiveness actually instructed patients to exercise into pain, specifically targeting a 3 to 5 out of 10 discomfort level. That discomfort is the mechanical stimulus telling the tendon cells to remodel and strengthen. If you avoid all discomfort, you're loading too lightly and the tissue won't respond. This is where most people fail. They reduce the weight or stop the exercise when they feel discomfort and the protocol becomes ineffective. Let me address the obvious question, why doesn't every doctor prescribe this? Because medical education trains physicians to treat symptoms with medication and procedures, not to teach biomechanics. The average medical school devotes perhaps 10 hours total to musculoskeletal medicine across 4 years of training. Unless a physician pursues specialized training in sports medicine or rehabilitation, they simply don't learn exercise protocols for tissue healing. Physical therapists know this science, but you need a referral to see a physical therapist, and insurance typically covers only 6 to 8 sessions, not enough time to guide you through a 12-week protocol. The economics of healthcare don't support spending 30 minutes teaching you an exercise you'll do at home for free. There is more revenue in injections, imaging studies, and surgical referrals. If you're currently taking blood thinners or have a bleeding disorder, consult your physician before starting this protocol. Eccentric exercise creates microtrauma that is part of the healing process, but in patients with clotting disorders, that could create complications. If you have a history of complete tendon rupture or surgical tendon repair, you need individualized guidance from a sports medicine physician or physical therapist. These general protocols assume an intact tendon with degenerative changes, not a ruptured structure. One more critical detail, your elbow pain may not be isolated. Very often, tennis elbow develops because of poor ergonomics, improper technique in repetitive activities, or weakness in the muscles that stabilize your shoulder blade. If your shoulder blade doesn't stay properly positioned when you use your arm, your elbow and wrist muscles work harder to compensate, creating excessive tendon stress. While the eccentric protocol will heal the tendon damage, if you don't address the upstream mechanical problems, you'll likely develop the condition again. Pay attention to your work setup. If you use a computer, your keyboard and mouse should allow your wrists to remain neutral, not extended or flexed. If you perform manual labor, consider whether you're gripping tools too tightly out of habit. Most people use far more grip force than necessary, creating unnecessary tendon stress. Here's your implementation framework. Starting tomorrow morning, set a specific time for your eccentric exercise session. 12 minutes at the same time every day. Morning is often best because you're establishing a habit before the day's chaos begins. Keep the dumbbell or hammer in a visible location that reminds you to do the session. Track your progress weekly. Write down your pain level during daily activities on a scale of 1 to 10 and note your grip strength by squeezing a bathroom scale and reading the number. These objective measures prevent you from relying on memory and provide motivation when you see the numbers improving. After 12 weeks of consistent practice, once you're pain-free, reduce to maintenance frequency of 2 to 3 sessions per week indefinitely. The tendon remains vulnerable to recurrence if you completely stop the loading stimulus that rebuilt it. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers dealing with tendon issues because it will directly shape what I cover in future videos regarding age-related tissue healing capacity. If this information helped you understand what's actually happening in your elbow and gave you a concrete path to recovery, subscribe to my channel right now. Every subscriber moves us closer to reaching more people who are suffering unnecessarily because the system failed to teach them basic tissue biomechanics. We're not selling anything. We're not promoting products. We're providing information that should be standard medical care but isn't because there's no profit in it. Hit that like button and share this video with someone you know who's dealing with chronic elbow pain, a parent, a coworker, a friend who's been told there's nothing to do but rest and wait. You may have just given them a real chance to solve a problem that's been dominating their life for months. The tendon that's causing you pain right now is not broken beyond repair. It is not a verdict that you'll live with this forever. It is structurally compromised tissue that will respond to the correct mechanical stimulus. Your body is not your enemy. That pain is a signal, and now you know how to answer it. 12 weeks of 12-minute sessions. That's 84 sessions. 14 hours total time investment to rebuild a tendon and eliminate a problem that might otherwise persist for years. You are not helpless in front of your own biology. You have the knowledge. The only thing it requires now is discipline and consistency. Start tomorrow, not Monday, not next week. Tomorrow morning, set your timer and perform your first session. Your future self, the one who can grip things without pain, who sleeps through the night without elbow discomfort, who does the activities they love without limitation, that version of you begins with session 1 tomorrow.